So, Dr. Rehm, what is a blepharoplasty?
So blepharoplasty has to deal with the aesthetics around the eye. So it's surgery that we do on the upper eyelid or the lower eyelid. Upper eyelid, we do that for excess skin typically, or a sagging upper eyelid. And the lower eyelid, we use it for the bags underneath the eyes, which patients can get as they get older. Some laxity in the lower eyelid allows some fat to protrude in the lower eyelid, and that's where they get the bag from. That's disconcerting, and so blepharoplasty deals with removing some of that fat and some of the excess skin from the lower eyelid, and certainly on the upper eyelid, removing the excess skin to help with the droopy eye.
Okay. All right, Dr. Rehm. So when you're doing a blepharoplasty, upper or lower, where are the incisions and how long would it take for us to get back to our social functions?
Okay. So the incisions are, on the upper eyelid, they're made deep in the crease, so they're hidden really nicely, particularly when the eye is open. On the lower eyelid, we either put them just beneath the lash margin or sometimes on the inside of the eyelid. And that depends on sort of our physical examination and what goals are with the lower eyelid. The incisions heal quickly. They're all repaired with absorbable stitches and maybe a few non-absorbable on the edge. And then those fall out on their own. They're pink. The incisions are pink for 4 to 6 weeks and then continue to fade from there. Certainly the first week to 10 days, there's some bruising and swelling of the eyelids that by that time frame, women are usually able to conceal or cover with some makeup. But 10 to 14 days is sort of return to most social functions. And 4 to 6 weeks, sort of regular activities, including exercise. But it'll take a couple of months for the incisions to fade. The eyelid skin heals really nicely, so scarring is minimal and well concealed and well hidden, typically in a crease of the eyelid.
Awesome. And so restrictions, like after surgery, what are you going to say? What are restrictions?
We tell people to keep their head elevated. It helps with the swelling, so sleep with the head elevated. You get some ointment or cream that you use in the eye that helps with some of the swelling that has some steroid and antibiotic. And so patients use that. There's not really a dressing to use. We do some cool compresses the first couple of days. And then from an exercise standpoint, we don't like people tilting their head down, which can raise the blood pressure in that area, which is going to cause more swelling and bleeding. And take it easy from an exercise standpoint for the first couple of weeks.
Awesome. Cool. So how long would it take you to perform this surgery?
The surgery is done in the operating room under a sedation anesthesia, so patients are asleep, but generally breathing on their own rather than with the ventilating machine. We use some local anesthetic in the skin, and it takes about an hour to 2 hours to do, depending on if we're doing just the upper eyelids, the upper and lower eyelids together. And sometimes we add other procedures when people have a blepharoplasty, their eyelid surgery, like cheek lifts and things like that. So that certainly would add some time. But in general, hour to 2 hours for the most part in the operating room. Outpatient, people go home the same day. As far as discomfort after the procedure, there's some pain and discomfort, but it's not bad. The patients complain primarily of the irritation of the eye, and that's what some of the ointment that we prescribe is helpful. And that's just usually for the first couple of days. That also kind of comes into play with patients' glasses and contacts. There is some swelling of the eye itself related to this surgery. And so we ask the patients not to wear contacts until that's resolved, so they have to be prepared with a set of glasses if they need that. Thanks for being with us today, talking about blepharoplasty. If you have further questions, give us a call here at the office. Be happy to see you in consult. And join us again next time when Mary and one of the plastic surgery group physicians will get together for a cosmetic consult.